Welcome to the Healthcare Intersection. We will explore everything related to healthcare and why it matters to you in a few minutes or less. Click on the subscribe button to access our content. In this video, we are going to focus on mental health. For a lot of us, mental health is something that we have to work on every day. It's not always easy, but it's worth it. So if you're struggling with triggers or just trying to get into a good habit routine, then stick around because this video will help you out. First, let's talk about what exactly mental health is. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. So let's start by talking about triggers. Triggers are events or situations that can cause a person to experience a difficult emotion or behavior related to their mental illness. This can include things like seeing an angry face on a news broadcast or getting into a heated argument with someone close to you. Triggers can affect people differently depending on their individual experiences with mental illness and trauma. In order to effectively cope with triggers, it's important to recognize them when they occur and take steps towards managing them as soon as possible. Learning relaxation techniques such as deep breathing exercises, avoiding environments or activities that may activate your triggers, seeking out supportive friends or family members who can provide comfort, recognizing warning signs of an impending trigger, journaling your thoughts or feelings before and after a trigger occurs, seeking professional help if needed, and creating a safety plan in case of an emergency situation involving your triggers. Next, let's discuss developing positive habits in order to better manage mental health issues. Positive habits are beneficial behaviors that have become regular routines over time that help foster physical and emotional well-being, such as maintaining good hygiene practices, exercising regularly, eating nutritious meals, practicing mindful meditation or yoga regularly, engaging in hobbies you enjoy like playing music or painting, spending quality time with friends or family members who make you feel supported and understood. These are just a few examples of positive habits you can develop in order to maintain positive mental health. Lastly, let's talk about how to cope with suicidal thoughts in order to prevent them from escalating into any kind of actionable behavior. Suicidal thoughts are serious but treatable, and it's important for those affected to understand that these thoughts do not define who they are as individuals, nor do they mean they will act upon them eventually. It is possible for these thoughts to dissipate once the person is given adequate help by professionals with experience managing this type of crisis situation. If you or someone you know is having suicidal thoughts, there are several ways you can help support them through this difficult time, including listening without judgment while providing empathy rather than pity, emphasizing the importance of seeking professional treatment, connecting them with suicide hotlines, reassuring them that they are not alone, even if they don't currently have access to close friends or family members who can provide support. Helping create an action plan which outlines specific strategies for coping when suicidal thoughts arise again. Encouraging self-care activities like taking walks outside in nature each day or starting a creative hobby, which encourages mindfulness such as drawing or painting. To conclude, taking care of our mental health should be something we prioritize throughout our lives, especially during times of distress when it's most needed. So if you're struggling, take the steps necessary towards establishing healthier habits. You don't have to go through this alone. Thank you for watching.